7, 6, 5, 4, 3, 2, 1.
Hi, do you or a loved one suffer from incontinence? If so, you're in the right place. Hi, my name is Matt Law with Health Benefits Associates, and thanks for tuning in to this week's episode of Hello Health. Actually, not this week's. You saw me a few days ago talking about Hello Health. We have another presentation today with Dr. Kent Sasse, who's going to teach us all about incontinence. We're going to be able to ask him questions and get answers in real time at the end of this presentation. But before we do, a few things. First off, if this is your first time watching Hello Health, welcome. Hello Health is a way that we at Health Benefits Associates connect you with local doctors and healthcare tips and tricks so you can stay proactive with your health. Our YouTube channel also has some other informational videos like the upcoming Mastering Medicare series, which actually starts next week on Wednesday. I'll be kicking us off at 3 p.m. on the 15th, talking about the top tips and tricks you need to know to find the right Medicare Advantage plan. During that presentation, we actually have a fun interactive component of the video. So we're going to learn and we're going to have fun. So make sure to stay tuned in for that. Now, this YouTube channel also has a lot of informational videos about healthcare updates, Medicare, contract changes with hospitals. You name it. If you live here in Nevada, you should probably hit the subscribe button and ring the notification bell so you can be updated as to when we go live or have a healthcare update for you. Now, I'm a face-to-face guy. I know I'm talking to you guys in YouTube right now. I'm invading your computers and your smartphones. However, if you want to come see us and ask questions in person, you can visit us at Health Benefits Associates in Reno, Sparks, and in Carson City. We'll be more than happy to help. Now, I want to come back to one thing. So we talked about the Q&A, which is at the end of this presentation. If you have a question, you can ask at any time, and we'll get you answers at the end of today's presentation. You can leave your questions in the comments section below this video, and if you have a question for Dr. Sasse or for myself, we'll get to those. Now, speaking of Dr. Sasse, Kent Sasse, I think we should call him Clark Kent. He is a true Superman and actually a bona fide hero. In 2011, he won the Healthcare Hero Award from Nevada Business Weekly. I also personally think that he flies around the world at light speed just like Superman. I mean, this guy is everywhere. He's worked in Nepal, he's studied in Madrid, at Berkeley, San Diego, UCSF, and at Boston. He's also fluent in English and in Spanish, and he's written and published 5 books. Dr. Kent Sasse is a true hero, not only in Nevada, but around the world. Now, the nice part is that he works here in Reno, Nevada. So if you're suffering from incontinence, I recommend that you give him a call and schedule an appointment so he can help you with your health care. Now, speaking of incontinence, let's kick it over to Dr. Kent Sasse so he can teach us a little bit more. Dr. Sasse, can you hear me?
I sure can. Thank you. Thanks very much.
Yeah, well, why don't you take it away? We're eager to learn.
Sure, happy to. Yeah, it's a problem that so many people have, but oftentimes is not talked about. And many times we doctors don't do a good job of asking people about it. And incontinence really refers to both the bladder leakage and leakage from the bowel side or from the rectum. Most people have this where it bothers them more from the bladder side, but a pretty high fraction of people will have bladder leakage and also have some bowel leakage. And this can come from a lot of different causes, but it's not normal. There's really no age at which bladder and bowel leakage should be considered normal and just ignored. It's not something you should just have to live with. Because there's really excellent therapies today that I'll get to in a minute that are not very invasive and that work very well. So I see quite a few people who tell me that their lives have been really kind of taken over in a way by having to wear pads and worry about where the bathroom is all the time and having embarrassing accidents and having to bring changes of clothing with them. It's sometimes somebody's parent that they're caring for, and this has just become a really an embarrassing but also just a frustrating topic. And sometimes the doctors that they mention it to just don't really have excellent solutions at their fingertips, partly because the technology has changed and it's perhaps not as widely known as it should be. Um, but what we do here, we have a center that's really dedicated toward understanding this. It's called the Continence Center. And so there's a little bit of asking questions. Really, that's the first place to start, just to kind of understand what people are going through. And so we get a good understanding of what the problem really is. Is it just when I cough or sneeze, I get some bladder leakage, or is it something that where I have big accidents in the day or at nighttime? Is it just the bladder, or is it just the bowel side, or is it both? And then we can craft a solution. Um, Historically, we've not done a great job with this problem. I'm a trained surgeon. I trained in general surgery and then did fellowship training in Boston in colon and rectal surgery. And I had the good fortune of working with a team of people who were some of the pioneers in pelvic floor physiology, meaning really understanding how the pelvic floor works and how the bowel and bladder sphincters work. And that was foundational research for some treatment that has really come forward over the last 25 years. But historically, we surgeons would try to stitch muscles together and try to do surgery, and it never really worked that well. Just as many people know who had failed bladder suspension surgeries or other kinds of surgical treatments for this. And nor have medications worked very well. It's kind of frustrating, but the main class of medications we actually now discourage people from using, despite the fact many millions of people are using them, because they're associated oftentimes with memory loss and some cognitive impairment, which AARP has told us we ought to not be prescribing anymore. So that's left a big void in the treatments. We're big fans of exercise and natural treatments and the least invasive, the less invasive therapies whenever possible. So we always combine our therapies together with some structured pelvic floor exercises that can be done by video or in person. But once we've understood what the severity of the problems are, very often the best solution is going to be a treatment that has emerged that is something called neuromodulation. And it's a lot less invasive therapy than doing surgery, for example, and even less invasive, one would argue, than taking a medication every single day. But it works on a technology that's a bit like a cardiac pacemaker in the sense that with a little inserted computer chip, a little gentle current can restore the normal heartbeat. And here, a little computer chip can be implanted under the skin that can restore the normal pelvic floor muscles and the bowel and bladder sphincters. And that's called neuromodulation. And the way you tell if that is going to be successful for a person is to do a test or a trial. It's covered by all the major insurance plans, including Medicare and all of Medicare's various subtypes. And the trial is a little 20-minute procedure in which we test a person's muscles and nerves, and we can tell if it's going to work. We can tell if someone's a really good candidate for that therapy or not. Um, and that's often the first place to start. If it is a successful trial, a person gets to sort of walk around and try it out for a few days. And if it is resolving the leakage, if a person finds, their pads are dry, they're not getting woken up at night with accidents, they're getting good warning time, then if they give the thumbs up, then we can come back and place the pacemaker like you would for the heart. Here we place it kind of by our back pocket. And that has about a 90% success rate. And combined, we think with our exercise program, we're often getting closer to 100% success with many, many people. That's really become the sort of the state of the art kind of best treatment nowadays. It remains a little bit of a best kept secret because the research in neuromodulation was only at a few centers, and it is slowly getting dispersed throughout the medical community. There's more and more young doctors coming out who are knowledgeable about it, but it's still kind of a small niche area where many people don't fully understand how effective that is. So we start with an assessment, just some questions, and we may review some medications. We'll always recommend some exercises, And then we'll talk about this technology here. If you can kind of see, this is the device itself that is this kind of cornerstone treatment that reactivates or switches on the natural muscles of the body. And with such a small little device like this, it really is amazing the quality of life that can be restored. Um, the uh, the interesting things about it are that when it first began, like a lot of technologies, it worked pretty well, but it was kind of a cumbersome device. They were large and they were clunky and they had metallic parts, and so it interfered with MRI scans. And of course, like cardiac pacemakers, if you're familiar, those batteries used to not last very long, so you'd have to go back in and have them swap out the battery. And the same was true for these devices. But the progress of technology is really quite amazing. And over these 20 years, of course, the size has come down now to this being the rather small nature of it. They've also now moved to some space age ceramic components, so it's compatible with an MRI scanner or CT scanner. It doesn't interfere really with anything, and they've managed to use the same kind of wireless charging technology that you see on TV or certain kinds of uh, uh, Samsung phones have, where you don't even really have to plug it in. You just have a charger nearby and it'll wirelessly charge the device. So that's allowed the battery life to be virtually infinite. It's actually guaranteed for more than 15 years, but we think it lasts, quite a bit longer. So it's really taken all the kind of potential headaches out of this technology in allowing us to kind of restore the normal bowel and bladder control, really sort of switching on your normal natural muscles rather than us trying to go in and do some repair work. And that's really been a game changer in solving this problem. Unfortunately, it's really only a small fraction of people with this trouble who ever reach getting to a specialist to really have it solved. Survey data shows that most people don't really get it fully explored with their doctor, and at best, they often get first line therapies with some medications, which unfortunately don't work very well, or with just a kind of a sheet to practice some Kegels or basic exercises. But most people don't really get training in more advanced exercises, and they certainly don't get exposure to sacral neuromodulation, which, as I say, has been the game changing therapy. Um, so that's really kind of what we're doing at our clinic. That's kind of the area that's had the most success worldwide and with a lot of peer review literature behind it. And that normally is quite a dramatic change and improvement in life for people that we're able to see and help with this problem. And in the future, I think the directions are that there's some innovations that will continue to come that keep improving this sacral neuromodulation technology. It's already become, very simple 20-minute little procedure where a person walks out with a couple of Band-Aids. But there continue to be little innovations in that space where I think we'll continue to see improvement as the years go by. And we have a few adjunctive therapies as well. If the problem is more in the bowel side, we have a few therapies that can help really restore the control and avoid that terrible leakage problem. But that's kind of catching us up on where we are in the state of the art at the Continence Center and what the best sort of therapy is for that nationwide. So I'll pause there, and I'm happy to answer any questions about it.
Awesome. That was a lot of great information, and we actually have a lot of good questions coming in from our live audience. Before we get to the Q&A, I want to make sure that everyone knows that if you enjoyed today's topic and you liked hearing about incontinence, make sure to like this video so we can bring you more content like this in the future. Now, getting to the Q&A, I actually have a question myself. Can you hold that device up, the neuromodulation device? Can you hold that back up again?
Mm-hmm.
That's cool. I was expecting to see something the size of like a smartphone, but it seems like it's just a
Right.
small device.
Yeah.
So you said you usually implant that near the back pocket. Is that something that you would feel if you're sitting down?
No, it's not quite where you sit. We've over the years we've experimented with different places where it can be placed, and there's kind of a natural hollow in the body, in the bones, and in the muscles right by our back pocket where you just don't feel it. It's not where we sit, so most people just have no awareness of it whatsoever.
Cool. That's awesome. And is that something that you would control with like a smartphone just in case you need to redial in your frequencies, or how do you control that?
Yeah, so for most people, it's kind of set from the initial placement and it works great, and they really don't have to do anything to it. So I would say for the vast majority of people, there's really nothing that they have to do. But yes, as you can imagine, with all this fancy technology, we can access the device and we can do a lot to improve it. We can change its sensitivity. We can change the programming. There's a lot of sophistication there. If it's not working perfectly, we can often improve it so it is working perfectly. We also send a patient home, anyone who has this, we send them home with a very simple device. And there's a simple remote that might turn it up or turn it down if they chose to. Uh, like I say, most people don't really need to do that, but a few people can tell that they feel like it could be made a little bit stronger. And so we will work with them to turn it up or down and just kind of talk them through that at home. And then as we see people in the office, like I say, we can do more sophisticated programming and access it with a controlling device. It's really pretty nifty how it just can talk to the computer without any special connections.
Yeah. Yeah, and I think technology is just getting better and better every day. And hearing about the ceramic devices, I think if anyone's interested in this, they should reach out to Dr. Sasse to learn more about what procedures can be done today and maybe some stuff that's coming up right around the corner. Dr. Sasse's contact information is in the description of this video, so make sure to reach out if you want to schedule an appointment. So now actually getting into some questions from our live audience. Looks like we have a few people saying, hey, Dr. Sasse, one of them being Guadalupe. So thanks for tuning in, Guadalupe. Our first question comes from Jimmy. Do people normally have both urinary and fecal incontinence or just one?
Yeah, about 70% of people have just the urinary side, and the rest will have some mixture of both. A small fraction will have just fecal incontinence. But there is a pretty good overlap, I guess, to restate that. When people come in with bladder leakage, about 30% of them will also have some bowel leakage. So there is a good bit of crossover. And it makes sense because the pelvic floor is all of the joined muscles and nerves together. And toward the forward area, they form more of the bladder sphincter. And toward the back area, they form more of the bowel sphincter. And so those nerves and muscles work together. And it's not uncommon that they are both affected. But, at the Continence Center, we see people with all of the above, some with just the bowel side, some with just the bladder side, and then lots of people with both.
Huh. Interesting. Next question is from Edward. If my son still wets the bed at 9 years old, does that mean he has incontinence? Any tips on what I should do?
Most of the pediatricians will say that that problem is a little bit different than the kind of problem that we see, and that they have techniques where they can work with young people, even through adolescence. Sometimes this is a problem that they work with. And there are techniques that they've worked with that are behavioral. Sometimes there's things that the child can do with respect to modifying their habits in terms of liquid drinking and going to the bathroom and emptying the bladder. But most of the time that can be resolved through the course of childhood. And most of the time, those young people are not going to be candidates for this neuromodulation therapy, but they'll kind of work through it in other ways before reaching adulthood.
So what I'm hearing is that and this is just on a general basis, people who are younger, it's more of a behavioral condition, whereas if you're older, it's most likely going to be a physical issue that needs to be resolved. Is that right?
Yeah, at age 9, it can be multifactorial, and there may be developmental and behavioral things that can be worked through. There are occasions where people do have neurological conditions, or they've had surgery or trauma. They've had reasons why there's damage or processes that have adversely affected the nerves and muscles. And so those are fairly small minority of kids, and they might be a candidate for us to look at. But most commonly, that's something to bring up with a pediatrician and possibly a therapist.
Perfect. And Edward, I would say, and I would say this actually to anybody, but being proactive with your health is way better than being reactive. So if you want to learn about your son's health, make sure to link up with a pediatrician or call Dr. Sasse's office just to get that actual healthcare advice regarding your specific situation. Next question actually comes from Guadalupe, who said hello earlier. What is the age cutoff for the procedure like this? My mom is 89 and has had issues with bladder control.
Yeah, there's not a definite age cutoff. We've had plenty of people in their 80s and 90s who've had successful neuromodulation devices placed that work quite well. I think it's more, the person and how they feel, and is it a big factor affecting quality of life? Someone who's lived to be 89 often has a multi-year life expectancy ahead of them, and so they may still be, able to interact with family and enjoy life, except for this darn problem of bowel and bladder leakage, and so it might make a lot of sense for that person. On the other hand, if someone is, really quite housebound or bedbound, and this problem is not the top of their list, then it might not make sense. So it's something we could talk over. If the person, your parent wanted to come in and talk it over, we can describe what's involved. But there's not really an upper age cutoff necessarily.
Perfect. That's good to know. And I would say that regardless of age, there's always something you can do with your health. But Guadalupe, if you are interested in that, please call Dr. Sasse's office for consultation. Actually, believe it or not, we have a question. Someone from our office is watching, and they just messaged me on my laptop. They were asking if there is a difference in how you treat men and women, specifically neuromodulation versus tibial nerve stimulation.
Yeah. So our experience, I have kind of a special or sort of a experience where I was involved in some of the foundational research regarding the pelvic floor therapy, and our research showed that the direct stimulation on the sacral nerve plexus, which is where this works, was going to have the biggest effect. And so I've always looked with a little bit of skepticism at the best published results of the tibial nerve therapy. And I would just say, I don't have a great deal of experience doing it myself. It does appear to require an ongoing treatment where a person will continue to go in at, intervals, maybe monthly or at a certain interval, and then have this treatment repeated in the office. Whereas this sacral nerve therapy is kind of advanced to the point, kind of like a pacemaker, where, one goes through this procedure once and then it's kind of working indefinitely over a long period of time. And I think the peer-reviewed literature shows that this technology has really surpassed basically everything else that's out there. But, I don't want to condemn it. If there's somebody who's having great results with the tibial nerve stimulation, then, I would say stick with it. But if it's something that's not successful anymore, or it's become kind of a sort of a burdensome nuisance to keep going in and having a repeated therapy, then maybe take a look at sacral neuromodulation and see if it's a fit for you.
Excellent. Perfect. Hopefully that answered your question. We have one more question I think we have time to get to. And I think you already answered this. They're asking, do you take Medicare? Is that right?
Of course, yeah. This is has been covered by Medicare for a long time because of that, really strong evidence about its effectiveness. And of course we take that.
Perfect. And just for any of you viewers out there, if you have Medicare, just know that there are a lot of different types of plans, different doctors lists. I'm sure Dr. Sasse accepts almost, if not all, almost all of them.
Yeah.
But just to better understand your options and where you can go, especially Dr. Sasse's office, you can always give us a call at Health Benefits Associates off air, and we'll help you with that. I think that is all the time we have today for the Q&A. If I didn't get to your questions, I will reach out to you personally with an answer. So just know that if you have any more questions, leave them in the comments section below, and I'll get to them. I want to personally thank Dr. Sasse for the great presentation today and taking the time to teach us about incontinence. Thank you, Dr. Sasse.
Thank you.
Awesome. Well, you guys, we had a lot of fun today, and we have a lot more fun cooked up in the next week. Next week, we have a Hello Health presentation on September 15th at noon Pacific Standard Time with Dr. Pazanowski from GI Consultants. He'll be talking about gallbladder, pancreas, and liver disease. Now, that day is going to be a very hot day on YouTube because not only do we have Hello Health at noon, but Mastering Medicare goes live at 3 p.m. Pacific Standard Time on our YouTube channel. So if you want to learn about the top tips and tricks to find the right Medicare Advantage plan for next year and to have a little bit of fun, I recommend tuning in. Now, my name is Matt Law with Health Benefits Associates, and you know what? Before you know it, I'll be back on your computer. I'll see you next week.